Hello, Dr. Vicki Peterson here. I'm often asked, how is it that we work with patients? What is our process? And also, kind of along with that question is, what is our preoccupation with the gut and the digestive tract? So I'll start with the latter, the digestive tract. The gut, or your small intestine and large intestine, or your entire digestive tract for that matter, is often called the second brain. Why is that? Because it's second in importance to the brain. Obviously, the brain controls the body through the nervous system. But when you think about the digestive tract, when you want a machine like your body to work, it needs fuel. And the only thing that gives it that fuel is your digestive tract. You can eat perfectly wonderful food, but if your digestive tract can't turn that into utilizable fuel that your cells then use for their energy and in order for them to do their job, you're never going to have a healthy body. So the digestive tract is absolutely critical in importance. The other thing that makes it critical is that it houses 70 to 80% of the body's immune system. So your immune system is what gives you your ability to fight bad guys, things like cancer cells and viruses and bacteria and all sorts of things like that attack the body, toxins. So this is it's your body's army, it's your body's defense team, if you will. It's in that gut. And what we know is when the digestive tract is not functioning as well as it should, or it's being barraged by foods that it doesn't like that you're eating, as an example, that will weaken that immune system, and it won't be as robust, it won't be able to handle toxins and offending agents that are coming its way, and that's very critical. So let's take a recent case. We had a young man. He was 11 when he came to see us. He had very bad eczema, and his eczema was so severe that he was scratching constantly, he was itchy constantly. To say that he was miserable would be a huge understatement. The only way he could go to sleep at night was with the help of medication that just kind of knocked him out. From the itching, his skin had gotten very thickened and darkened in patches. When we actually tried to do a blood test on him, we couldn't, because the skin was so thick, we actually just couldn't penetrate it. So we had to send him to a specialty lab in order to get a blood draw done. As I said, to say that this young man was miserable would be an understatement. He couldn't sleep, he was constantly itching, he couldn't concentrate, he was having trouble in school. Of course, emotionally he was miserable, he had some digestive complaints, on and on. It was not a pretty picture. And his parents were wonderful, they were very dedicated. They had tried a lot to help this young man. He had had the problem for a very long time, and we frequently are kind of the port of last resort, and so they came to us with kind of that fingers crossed, hoping we could do something. We found out that he was gluten sensitive as well as dairy sensitive, and his mother, as I said earlier, was great. She was very disciplined. Whatever you told her to do, she did. And of course, the young man was compliant as well, but certainly at 11, you need a parent that's really going to support you in these changes. So the mom was fabulous at that, and the young man was great as well. And he is now pretty much cured of his eczema. He has some lingering up in the scalp, but that's going away as well. And definitely a success story, which one we see often with eczema. So where did we start with this young man? In our current society, a skin condition means you look at the skin and you apply things onto that skin and you put steroids on the skin, instead of appreciating the fact that not only is the skin the largest organ that we have, but the skin health is reflecting the colon health or the gut health. So of course we started in the gut and we looked for food reactions, anything that could be challenging the gut, and sure enough we found gluten and dairy as a sensitivity. Also, eczema is considered an autoimmune disease, and so as soon as you get into that autoimmune category, you know that that immune system is overstimulated. It's starting to attack the body. We also know that as soon as you have an autoimmune disease, if you have one, You'll get more than one as time progresses, and that certainly was something we didn't want for this young man. So applying some steroid cream that kind of made the skin look better for a little while. What does that really do? Is that getting to the root cause? Far from it. Not to mention the fact that steroids actually can create a leaky gut, so create damage to the very system that's causing the problem. So that's really the wrong way to go. So instead we got to that root. We took all the stressors we could identify off of the system. He actually had an infection that we found by doing a stool test on him. There's a lot of different varieties of stool tests. Some are much more comprehensive. We use a very comprehensive one. It's not just looking for 1 or 2 parasites. It's looking for parasites and amoeba and bacteria and yeast and all sorts of different things. So it definitely is kind of worth its weight in gold, if you will, as far as the data that we get from it, because then we know what other offending agents are putting stress on the immune system of the body, especially in the gut. So those were the major things we found. Certainly we worked with nutrition, and you know, once again in our society we love that take a pill model. It's like, oh, what did you use? What was the supplement? You know, it's not so much what the supplement was as removing the stressors, and that's something that is very much a key philosophy and a key motivating factor into what we do here at the clinic, which is when you're looking for the root cause problem, you're looking for the problem, you're looking for the thing that's getting in the road of the body being able to heal itself, because the human body is an amazing machine and it is able to heal itself. But sometimes it can get so burdened that it's unable to do that and it needs help. So what we do is we try to isolate what those stressors are on the body. In this case it was foods, it was infections. He as compromised as his gut was from both the foods and the infections, yes, he had been malabsorbing some nutrition and we put that back in, but it wasn't just the lack of that nutrition that was causing the problem, because you can kind of plug the holes, but it's kind of like putting a bucket under the ceiling when it's leaking. You can prevent the floor from getting wet by putting the bucket there, but that's not really solving the problem, right? It's the hole in the roof. So it's always about that root cause, and that's really our motivating force here at the clinic, whatever it is. Why do we start with the gut? I mentioned that earlier because it's such an important system. The immune system is housed there. If someone has any sort of autoimmune disease, any sort of reaction to food, any degenerative disease, all of these have a start at the gut. We don't just stay there. There are secondary factors as well, and there are other organ systems that certainly get affected. But you can't expect to ignore the gut. Maybe it's better said that way, because a lot of times people say, you know, I'll do whatever you say, I'll take whatever vitamin you say, supplement, but I just don't want to change my diet. I love that one. I say, you know, forget it. We can't help you then, because if you're not willing to change diet and lifestyle, the chances are almost none that there's none of that going on with you based on some chronic problems that you have. It's almost always a factor that somebody needs to change their diet and change their lifestyle. And when I say lifestyle, maybe somebody has no food sensitivities, but they're just eating crap food, you know, they're eating junk food. That's not doing them any good. The fats they're eating are pro-inflammatory, so they have joint pain. Even if they have no food sensitivities at all, but that's still going back to diet and lifestyle. They sleep 4 hours a night. It's not going to work, you know, the body needs more rest than that. They never exercise. Not going to work, you know. So these are some foundational things, and maybe you're sitting there going, oh, it's way too much work, forget it. It is some work. It actually is some work, but aren't most things that are worth having worth a little bit of work and effort? I find that usually is the case. So we work with our patients, and we don't expect them to do kind of a 180 overnight. We work with them and make slow changes so that over time they've made very big changes with our support and our guidance. And so that's kind of how we work. You know, recently we had another patient with also eczema, and interesting in the difference, because this particular patient didn't, also a young man, didn't have parents that were extremely supportive, and they were, you know, not so willing to make dramatic changes. And while he's still improving, it's slow, and they were complaining that it was slow. And it's slow because they weren't listening. You know, they weren't making the changes that need to be made. Sadly, especially when it comes to gluten and dairy and creating such irritation on the gut and the immune system, it's not a I'll do a little bit and hope that helps kind of scenario, unfortunately. You know, gluten is a zero tolerance type of event, and we're finding dairy is much that way as well. You just you can't have a little gluten and expect that you're not going to have a repercussion from that. So anyway, I wanted to kind of go over the whole root cause medicine and why we work the way we work, and how we figure out that root cause. I mean, there's a lot of lab tests involved, but it's also getting a very in-depth history from the patient and understanding how organ systems affect each other. You know, so if somebody's under a lot of stress and they're depressed, in our country you just want to hand them an antidepressant. It's ridiculous. You know, what's the root cause of why those hormones are out of balance? Not that gluten causes everything, but you know, we know that gluten creates major nervous system problems. A hormonal balance can come because the adrenal glands, which are the stress gland that in turn make the sex hormones, they're out of balance. You see, so root cause is never handing anybody a pill. Yeah, it might be the Band-Aid that's needed temporarily, because somebody has high blood pressure. Let's say they walk in with high blood pressure. You're not going to just leave them with that high blood pressure. You're going to put them on a medication temporarily to get that blood pressure down out of the danger zone. But that doesn't mean that as soon as that blood pressure it goes more normal because of the medication, that you think you've done some fabulous thing. You haven't. You've gotten them out of a danger zone, perhaps, but now we figure out why. Where was that high blood pressure being generated from? And there's always a cause. And when you find that cause, then they don't need the medication anymore. And that's one of our specialties, is getting people off medication. We do that all the time. It's one of the things we pride ourselves on, because not just because they don't need the medication anymore, because we know we've gotten to the root cause and their health status is elevated. So it's that's how we work. That's why we work the way we work. It's very effective. It does involve that sort of, you know, hand in hand working together with our patients, and it does take some time and it takes discipline, but it's worth it. I think your health is worth it. So that's what I wanted to talk to you about today. I frequently get this question, so I thought I would just answer it in a video of why we focus on the gut predominantly, or first, not only, but first, and then also how we work. You know, what is our thought process? Hopefully, if I've answered that question. If not, let me know, and I can answer your question. And until next time, I wish you very good health.